Why can't we bring them back? You know, if you have depression because your estrogen's low, well, why don't we give you estrogen? No, we'll just give you an antidepressant. Yeah. You're like, well, what? But wait a second, time out. That's a Band-Aid. The problem is the low estrogen. Or, oh gosh, I'm really edgy, I'm really irritable, I can't sleep, or I wake up multiple times during the night and can't go back to sleep, caused from low progesterone levels, or irritability and anxiety caused from low progesterone levels. Why are we giving Xanax for that or giving sleeping pills for that when it's the progesterone that is the problem?
All right. Well,
so that doesn't make sense, does it? I mean, it's like, why are we doing that? Well, here's one of the reasons. This prevailing mantra that estrogen causes breast cancer, okay?
Right.
And the C word is enough to
scare
make
anybody.
somebody pause,
Yeah.
And so, like, I'm sure the sale of Coca-Cola fell when they said the caramel color causes cancer. Like, oh my God, stop eating it. I'm going to drink Sprite instead, whatever.
Right.
But the C word will scare you. Now, I want to tell you a couple things about that is how, I was kind of alluding back to some other things, but as far as the estrogen in the breast tissue and the estrogen causing those changes in the breast tissue. So how can we reduce that concentration of estrogen in the fat tissue? And the answer is give you the estrogen you need so you don't have to make it in the breast tissue. That makes sense, doesn't it?
Yeah.
And you put it on the cream, you put on enough so that your FSH is 91, now it goes to 60, now it goes to 40 or 35. It may not necessarily go to 3, but it's going to go down.
Okay.
And when we reach that point, your brain is like, hey, we got enough estrogen. Hey, that fat stuff, we don't need that anymore. You don't have to make estrogen in the fat tissue anymore. And you go, oh, that's a good thing.
That's a very good thing.
Yeah. So now, I've been to so many meetings where they'll say, someone will stand up and go, well, I use bioidentical hormones. And this seems like your experience with it. I use bioidentical hormones, but I use a very, very, very small amount of estrogen, and I stop, after 1 week because it could cause cancer. Wait a second. If you're giving a small amount, first I tell these people, I kind of raise my hand. I'm not always the best friend of all these people. I say, did you fall asleep in your cardiac lectures in medical school? Because as far as I know, the cream that you put on your arm that goes to your heart, what part of the cardiac output goes to your breast tissue? Like 0.5%? So if I put it on here, is like all the estrogen going right to your breast tissue? Well, of course not.
No.
It goes to your brain. Oh yeah, that's great. It's going to help your memory and your depression and your thought process. Goes to your skin. Oh, it helps with aging on the skin. It's so healthy. Goes to all your internal organs. Goes to your heart. Oh, and I'll tell you how beneficial estrogen is for your heart postmenopausally. So it goes to all those places. And the next part about that is estrogen. Do you think if there's a high concentration of estrogen, like 20 to 50 times, do you think that little bit of estrogen is going to go to that area? Because in biology and in natural science, things go from a high concentration to a low concentration.
Right.
That's like, if you ever went to go see Niagara Falls, it is not going uphill.
Right.
Okay? And that's because it goes from high to low, right? So why would, if I've got 50 times concentration of estrogen in the breast tissue and I provide like 1% of it, why is it going to go in there? It's not. It's going to keep coming out because that's the primary source. So you shut that down by giving the estrogen. The brain, which is now bathed in a plethora of estrogen, says, I'm happy here. Let's kick back and have an iced tea. We're doing great here now. So forget the hot flash. I always think of the hot flashes. You think of this giant gorilla pounding this drum, boom, 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 and it's like, and you can't anticipate it. Sometimes spicy food, sometimes alcohol, but the bottom line is you have no control over it. And unfortunately, it usually appears at the times you least want it to.
Absolutely.
How does it do that? Why does it? Are you starting to get one right now? That's okay. It does. That's okay.
I feel like somebody just plugs me into a light socket, and it just, I can be brought on by just the warmth of another person's hand.
It's like, don't hug me. Don't
Yeah,
hug me.
don't.
Well, by the way, they're going to be gone in 2 weeks. Okay? They're going to be gone in 2 weeks. And you know, and the reason is, like I said, I'm a little different. I give a lot of estrogen because I'm not in the camp that says, well, I only give a little amount because I'm so afraid of cancer. I'm like, the problem is if you give a small amount, you're still making it in the breast tissue, right? You need to give enough to break the brain happy so it stops telling the breast tissue to make more fat and make more estrogen.
Okay, that makes sense. That makes real good sense.
But so that's this process, and that's why there's a lot of doctors who use a very, very small amount. Now I don't know, maybe it's me. I was kind of born and raised as a surgeon and a heart surgeon, and my approach is maybe a little more aggressive. I mean, if someone comes to me and their aorta is ruptured, I don't sit there and go, we need more tests and let's watch and let me read about this.
Yeah, right.
I'm like, open the chest, let's fix this thing now, And maybe that's just my personality, and that's the way I approach estrogen. I just talked to a woman whose estrogen level, I was like laughing at her because I said, they're kind of high, but you have an estrogen level, and she had the estrogen balance of a 22-year-old. I'm saying, well, and we've been working about 1.5 years, and I said, maybe I'll back it down a little bit because how about you being a 30-year-old instead of a 22-year-old? She goes, and she's 56. She's like, I'm liking it. She loves her brain is working. Her skin looks great. People are like, what are you doing? What are you doing? And that's also one of the common things. People will come up to someone and they'll say, oh my gosh, you look great. You're losing weight. Your skin looks good. What are you doing? And they say, well, I'm using bioidentical hormones. And they go, oh. So they go back to the family doctor and go, yeah, they go back to the family doctor and they go,
No.
I was just talking to Cindy and she said how she felt so good. Her memory was back. She's not on antidepressants. And she's taking bioidenticals. And their response is, oh, don't take that. That causes cancer. Right?
Well, I can't imagine that
That's what it does. And then so the person goes, yeah, okay, well, I don't want it to cause cancer because that C word is scary. So they see you 3 months later and they go, wow, you look even better. And they, what are you doing again? The bioidenticals. Oh, well, I talked to my doctor and they said it causes cancer and it's bad for you. And you go, well, what do you think? You keep looking at me and I'm feeling better. What do you think?
Very same conversation just before we left. Oh, I don't know about that, Cindy. I said, well, I'm going to go find out. That's exactly.